So welcome everybody to Trillium Health Partners breastfeeding class. It is time to latch on. Topics to be covered in class today, well, the benefits of breastfeeding, the feeding recommendations, skin-to-skin care, hand expression, feeding cues, positioning and latching, feeding positions, breast pumps, nutrition and breastfeeding, partner and family support, and community support. Now, there are several benefits of breastfeeding for mom and the family. Bonding, because mom gets to have that baby close to her when feeding. It's convenient because it's saving time and money. Moms that are able to give the milk that they've got don't have to buy formula, and that's a huge cost savings. Right now, the cost savings of formula has shot up, I think, up over $200 and $300 a month. So it has increased a lot since COVID-19 came on the scene. Minimizing the risk of postpartum bleeding, absolutely, because the hormones help to regulate the contracting of the uterus, and that helps to minimize postpartum bleeding for moms. It helps to minimize risk of postpartum mood disorders because while breastfeeding, the hormone levels are in a good balance for the mom. It helps to increase metabolism for the moms so that they are having more weight loss while breastfeeding. Those moms tend to lose their weight a bit faster. For the baby's got bonding with mom, increased immunity. It's got milk that's easy to digest. Even a baby that is formula feeding, if they're getting some amounts of breast milk, it does also help them to digest that formula. Decreased risk of ear infections, decreased risk of asthma, decreased risk of diabetes and obesity. So in order to have better overall health, we want to get as much breast milk in as we can. Feeding recommendations, well, the World Health Organization recommends exclusive breastfeeding for the first 6 months with the introduction of complementary foods at 6 months and continued breastfeeding for up to 2 years and beyond. And around the world where there may be a little more longer breastfeeding, that is the overall average recommendation for that 2 years and beyond to the toddler stage. Despite the fact that they will be eating other foods, those children will still continue to get the immunity benefits that breast milk gives and the comfort and the bonding with their moms. The Canadian Pediatric Society recommends that breastfeeding for the first full year of life is what we would achieve, and that the CPS recommends that all breastfeeding babies should receive a daily vitamin D supplement in the first year of 400 international units daily by mouth. That is a liquid medicine that the baby will have dropped to its mouth once a day at either feeding time or what time works for the family. Feeding recommendations, we want to make sure that babies are feeding often enough. And I know that's often a big challenge for moms. How often should I feed my baby? How should I feed my baby? But we want you to understand that breastfeeding is a natural but learned skill for mom and baby. So it's going to take some time. You want to be patient with yourself and the baby. And in the first week or so, baby really needs to be fed at least 8 times or more in 24 hours. Baby should be fed frequently, and we want to make sure that we're following baby's cues. Babies actually sometimes might cue even more often than that. So a newborn baby, because they're sometimes only getting teaspoons at a time, might cue to feed and request to feed as high as 12 times in 24 hours. So there is no real maximum, but the minimum would be 8 times in 24 hours. We want to make sure in that first week, the baby's not waking by the 3rd hour, that we actually wake the baby up, change that diaper, get the baby ready and interested in feeds for that first 2 weeks until baby is returned to its birth weight. And usually by the 2nd week, it's getting enough milk at the breast and is gaining well. So then you wouldn't have to wake it as often. Once baby's back to birth weight and gaining, baby can go longer between those feeds. By the 3rd to 5th day, mom's milk supply should increase, and she should already find that frequent feed slows down. It sometimes can pick back up and have cluster feeding or frequent feeds occurring again when baby's having growth spurts. And mom should just know that that's normal. It's just baby's way of bumping up the milk factory. Breastfeeding getting started. This booklet is a booklet that would have been given to you once you had the baby, and there's lots of fabulous information in there from Trillium Health Partners and also from Peel Region Public Health. And it's got a lot of resource numbers at the back and lots of information in the middle. Hand expression kit. We've got a hand expression kit that we will give to you so that once you're here with us, you can try to remove that milk that will be needed to be given to your baby. Hand expression kit is a really useful tool because many times those newborns are not ready for that new job of breastfeeding. They might have decided, I feel a little too tired after birth and I just don't feel like sucking, or they suck for 5 minutes and fall asleep on you. So using a hand expression kit is a valuable way for mom to remove that breast milk that she's got and be able to still give it to baby. So there's the little spoon, there's the cup, there's the little red syringes, and that colostrum can be taken from mom's breast and given back to baby by any of those means. Colostrum, every drop is liquid gold. Breast milk, we want to be making it work 1 drop at a time. So by trying to take it out from mom and give it back to baby, at least baby doesn't miss out until it's ready to do that job well. And just know that it's normal for babies to take sometimes a few days and sometimes a few weeks to get that job done well. Warm compresses and expression are tools also, or techniques that can help to make that breast milk flow a little bit better. Warm compress helps to soften the colostrum, which is thick and sticky initially like honey. So it moves very slowly, and sometimes babies go to do their sucking action, but they're not getting the reward they're looking for. So putting a warm compress on will help to stimulate the milk ducts to release that milk, and it'll assist, the hand expression assists with milk removal to support that supply and demand. Breast milk is made by supply and demand, so the more we remove it, the more the body replenishes and makes back more. Now, increasing milk supply will help for the babies. It helps to manage feeds of babies with low blood sugar. So if baby's not latching well, we could take a little of that colostrum out. We could give that to baby with the spoon or the syringe, and that will help to bring the sugars back up to good levels. Latching, the baby will suck with ease at the breast once we've increased the flow by doing some hand expression. So the more we can remove the milk, the better supply mama will have. And of course, then if we're going to have more of her own milk, we'll have a decreased need for formula. Now, how do we hand express? So we want to make sure that we hold that breast with your fingers and thumb cupping the breast like a C. And we want to make sure that our hands are there, but away from that darker or pinker areola. And depending on skin color, then this area might be pink or brownish. So you're going to hold on well. You're going to press your fingers and thumb back into the chest. You're slowly compressing your fingers forward, and you're not touching the nipple. And you actually might have to do that a few times because those drops are quite thick, that you might have to do it a few times till a little bead or drop starts to appear on the tip of the nipple. And release that without moving your hand from the breast, and you just keep repeating till that milk appears. And then that is that valuable liquid gold that you're going to use later on.
Skin to skin. Skin to skin allows babies to be close to parents so they can see their feeding cues. We love skin to skin because it helps to regulate the baby's body temperature, their blood sugar, keeps them awake when they're breastfeeding. So this is really important to be skin to skin so the baby stays awake while they're feeding. Feeding cues. How do we know when it's time to feed the baby? We're looking for cues. Early cues will be baby's hungry, stirring, opening up the mouth, small little actions, rooting, looking for the breast. Mid cues, now he's starting to get more hungry, physical movements, sucking on the hands. Late cues are when the baby is crying and fussing, very agitated. It's really hard to feed a crying baby, so we want to feed them before they start crying. That's why it's important to watch these cues, because that's the only way he can tell us when he's going to feed. If the baby is fussy and crying, then we're going to settle him down first, skin to skin, even on a clean finger fat pad up, let him suck on your finger until he's calmed down. And now we can try and latch him on the breast, because it's a lot easier to latch a settled baby than a crying baby. The question I always ask is, say the baby is now 8 weeks old and he's feeding very well. he's gaining weight, he's exclusively breastfeeding. Can I now put him on a schedule? And the answer is no. Because if I say I'm going to feed him every 3 hours and he starts to show those cues earlier, I am delaying that feeding and he's going to end up losing weight. So this is why these cues are so important, because it's the only way our babies can tell us when it's time to feed. Feeding positions. There's lots of different positions. Probably the most common one is the cross cradle hold that we start with our newborns in hospital. And what we always start with is baby's ready to feed. You've followed those cues. I'm dressed to feed skin to skin because we know how much better they will feed skin to skin. Plus it stimulates your milk production too. You might want a pillow, a breastfeeding pillow. Some women don't want anything. Whatever gets the baby in the best position for you while you're feeding the baby. So for the cross cradle position, I would hold the baby. We support the baby underneath the head, so at the base of the shoulders, underneath the neck, and engulf their body right beside us. So we've got a nice hold of the baby. I don't want to hold the baby on the head because that's very distracting to the baby. So I'm going to support behind the neck and the shoulders. For the breast, we're going to hold the breast, thumb on top, fingers underneath, behind the areola. If we hold too close to the nipple, that's the only place the baby can latch is the nipple. And then mom gets damaged and the baby is not going to be able to compress the ducts to get the milk. So we need to bring the hand farther back. So when we latch the baby, we say nose up to the nipple, nipple to the roof of the mouth. So the chin is into the breast and the bum and legs are into mommy's body. When they're in that position and they're looking up at mom, the baby is compressing the ducts properly and the baby is in a good position to feed. So that is the basic hold that we initially teach our mummies. As the babies start to learn how to feed better, because we know breastfeeding is a learned behavior, we're going to probably go into the cradle position and hold our baby this way. And we see a lot of mummies that feed this way, especially when it's your second and your third time baby. But I always think cross cradle initially is better because if the baby slides off the breast when you're starting to latch, you can easily relatch the baby by supporting in the cross hold position. For the football position, we find it helpful for small babies, larger breasted women, and mummies that have had a C-section. So again, we're holding the breast the same way, and we're holding the baby the same way, and bringing the baby nose up to the nipple, nipple to the roof of the mouth. And I can see the baby eye to eye. Again, the chin is in and the bum and legs are in, so the baby is in the best position. If mommy's complaining of sore nipples, again, this is a great position because every time you alternate positions, you alternate where the pressure point is, and it allows that area to heal. Side lying would be another common position where the baby's on his side, you're on your side, and support behind both of you. It's the most challenging one because it's the hardest position to check the latch. So we really encourage you to try the other positions and get comfortable with them prior to side lying. Side lying, great for middle of the night when you're doing short feeds, you can watch how the baby is doing and then put the baby back in the bassinet after the baby has been feeding. Again, we're just reinforcing the steps of positioning and how to support you and the baby, which is really important for a good feeding. Latch. A good latch is the key. So what we always want to remember is nose to nipple, chin to breast, and tummy to mummy. Because if a baby is laying on his back and his head is turned, the baby is not swallowing. So always remember that little rhyme so that the baby is positioned properly at the breast, and we'll do a nice latch. Latching is the key, and we want to make sure the baby is latching deeply. In these two diagrams, we see the first one, how the baby has a shallow latch, and you can see the lips are right at the base of the nipple, and the baby is compressing the nipple, thereby not getting the milk, and mommy is going to get damaged. And those are a lose-lose way of feeding. optimal attachment, baby has a nipple and most of the areola in the mouth. This way, the baby is compressing the areola, compressing the ducts, so the baby is going to get the milk. And it's going to be not painful for mom, because a latch should not be painful. You should feel a pulling or a tugging, not a pinching. If the baby is pinching, the baby is latching too shallow. As you can see in this diagram, the baby's lips are flanged out as well. You used to say just like a rose petal, and that way again, the baby is compressing the ducts properly. The nipple should always look the same shape before the latch as after the latch. If it's pinched and flat, when the baby comes off, the baby's either not latching well to begin with or sliding during that feeding. So if a mommy is feeding and the baby starts to shift a little bit during that feeding, and now she feels pain, she needs to unlatch the baby and relatch. How do you do that? You do baby finger in the corner of the baby's mouth to break that seal so you can take the baby off without damaging the nipples. If not, you're going to do even more damage than what was done before. So making sure to break that seal and always relatch the baby properly for a nice deep latch. So great videos that we have for you, how to know the baby is feeding well. Each of these is wonderful and helpful, especially I would say middle of the night when you're feeding and want to reconfirm that you're doing a good job. These are great videos to watch and very helpful to you. How to know baby is feeding well. Baby latches and sucks well at each feeding and taking both breasts. We always like to offer both breasts in the beginning because the baby is learning how to feed, and we want to make sure he's doing well on both sides. He might not feed the same amount on the second side. He might feed a lot less, and that's okay. The next feeding, you're going to alternate where you started from. Again, so baby is learning how to latch on both sides and do positioning well on both sides. Again, we want to make sure he's waking for feedings 8 times or more per day. We always put 8 as the minimum and never a cap on the maximum because that can change day to day. You can have baby that's having a growth spurt and might feed 15 times a day, whereas the minimum should always be 8 times a day in 24 hours. Baby is wetting and stooling in the diaper appropriately. This means 1 wet diaper with every day of age. In day 1, 1 pee, day 3, 3 pees. By the end of the first week, 6 to 8 pees in 24 hours. And those diapers are going to get heavier with the pees because mommy's volume is increasing and baby is feeding better at the breast. The poops will vary. Black thick meconium that changes to a yellow mustardy stool at day 3 or day 4, which is going to be a little bit liquidy, seedy, and that's breast milk stool because we know how well breast milk is to digest. By the end of the first week, 2 to 3 stools per day. And these are telling us how the baby is doing. Nipples, again, should be comfortable, as I said before, during and after the feedings, because that tells us that he's latched well. I think the biggest thing for me is the baby is settling after feedings, because if a baby is consistently going to the breast every hour per hour, you know he is not getting enough. And he's telling you, I need to feed more. So looking at all these factors. The other thing I have to mention is when we ask you how often a baby is feeding, it's beginning of feed to beginning of the next. And that's really important for looking at those 8 feedings in 24 hours. Okay, this chart, tummy size feedings and elimination, is in your Getting Breastfeeding Started booklet, which I love this booklet because it's got all the information that you can use. Again, reaffirming how often should I breastfeed? What's the baby's tummy size? So you can see over the days and weeks how it changes from the size of a cherry to the size of an egg. Going over wet diapers, what that urine should look like in the diaper, and then the stools and what that should look like. Pees tell us they're hydrated and poops tell us they're nourished. So we always want to pay attention to both of those. Baby's weight, they always lose initially, and they should gain back to birth weight by 10 to 14 days of age. And this is a standard rule and very important. And then gain regularly as the months go on. Other signs, the baby has a strong cry. He's very active. Your breasts are going to feel softer after the baby comes off because the baby has been drinking at the breast well. And we're watching not just sucking, but you always want to pay attention to the swallows where the baby dips the jaw and you can hear that sound as he is drinking. So all these are good signs that the baby is doing well. So who needs to pump? There's lots of pumps out there. Basically, we have a manual pump and an electric pump. Manual takes milk out, but it does zero stimulation to the breast. So great for later on if mommy is going out, storing some milk, and she has a good milk supply. But initial phase, in the newborn phase, a manual pump wouldn't do the work. So what she needs is a double electric pump to give mommy the proper stimulation. Hand expression, we know that we've talked about prior, is great because it helps to increase that milk stimulation in those first couple of days. But if we're helping to build that supply long term, we want to use that double electric pump. Pumping is highly recommended for if a mommy has a previous history of a low milk supply, latching issues, or especially breast surgery, diabetic mummies where milk takes a little bit longer to come in and baby's blood sugars can be lower, small gestational age or large gestational age babies, multiples, definitely mommy should be using a breast pump for twins, triplets, etc. Flat or inverted nipples, the pump can actually help to bring that nipple out a little bit if the baby is having a hard time latching. And if she has been supplementing with formula, definitely we need to get mommy to start pumping because the body needs that extra milk stimulation to increase that milk supply. NICU premature babies. These babies are not feeding like a full-term baby would. They might not feed 8 times a day. They might not have the motor strength to feed the way a full-term baby does. So we want to make sure that mommy is using a breast pump to increase that stimulation and offer the baby the express milk as needed. NICU, as I said, premature babies, mommy would be encouraged to use a double electric pump. If a baby is tube fed, they can use the breast milk to tube feed them, gavage feed them, bottle feed them. And we know, especially for premature babies, how important that breast milk is with all those wonderful antibodies for that compromised baby. Double electric pump, here's an example of a double electric pump. Making sure the double electric pump is right for you. So always speak to somebody knowledgeable about breast pumps to find the pump that would be suitable for what you need it to be. The piece that goes on your breast is called a flange, and that needs to fit properly as well, because if it's too big or too small, that can affect your milk supply and your comfort level. So again, making sure somebody is assessing that to make sure that's good for you. How long can I store my breast milk? So in your booklet that Peel has put out that we've talked about, goes over to the storage time for milk. Room temperature lasts a long time, 6 to 8 hours. In the fridge, 3 to 5 days. In the fridge freezer, 3 to 6 months. In the deep freezer, 6 to 12 months. If you're storing it in the fridge or the fridge freezer, please put it directly into the unit as opposed to the door, which cannot be as cold sometimes. And also an insulated cooler with an ice pack for 24 hours. So long time that you can store this milk. To warm it up, you put it in a bowl of warm water under the running water for 10 minutes or so. You can put it in a bottle warmer, never in the microwave, never on the stove. And for the frozen milk, you can thaw it out in the fridge overnight and do the same process when it comes out. So a long period of time for express milk, which is wonderful. And always use the oldest milk first when you're getting your milk out of the freezer. So what foods can I eat while I'm breastfeeding? And that's a question that every mommy would ask. So what we look for is good nutritional balanced diets, just like when you were pregnant, and everything in moderation. So we say a cup of coffee, yes, a pot of coffee, no. Common sense. But generally you can eat everything that you had before, and make sure that you're eating well. Even if you don't have a big appetite, when you're sitting down to breastfeed, have a glass of water, milk, or juice beside you, have little snacks so you're getting enough nutrition while you're breastfeeding the baby, because it consumes a lot of energy and you need extra calories when you're breastfeeding. Partner and family support, very important. We want to make sure that mommy is having help. It's teamwork, even if the partner is changing the diapers, settling the baby, skin to skin, bathing the baby, and mommy resting in between those feeds, because that's really important. You're up frequently feeding, and especially at nighttime, so you want to make sure that you're getting that rest and that you have support around you. Mutual respect and decision-making to meeting the baby's feeding needs. That's important because you want to be on the same page as your partner on how your feeding is going and what you are choosing to do feeding your baby, because it's teamwork, and breastfeeding is hard. It's one of the hardest things you do. And once it all fits into play, it's the easiest thing you do because it's right there and it's meant specifically for your baby. But again, you need that support. So there's lots of support in the community, and using friends and family around you to help is very beneficial for you. Community support. Babies should be seen in the first few days after discharge by their family doctor, midwife, or pediatrician. They will assess the baby's weight and ensure that the baby is feeding well. These are important appointments and are expected to be booked by the parents prior to discharge. Community breastfeeding support can help to build a mom's confidence about breastfeeding. So very important to reach out to some of these supports. And in hospital, we go over lots of different supports that we have available, and very helpful for mommy to make sure she has follow-up and that she is not left on her own to breastfeed. Breastfeeding is achievable with support. Again, family support, breastfeeding community supports, physicians, lots of help out there. We also have in the community lots of different websites which are on this slide, and Bilingual Online Ontario Breastfeeding Services, Breastfeeding Hotline, which is telehealth 24 hours a day, 7 days a week, can help to guide you and even give you somewhere to follow through with later on. Local public health unit, and you go through the government for their website, the area that you're living. And virtual appointment with lactation consultants are available as well, and certainly private ones if that's the route you want to go. But there's many, many support systems out there for breastfeeding, because we just want to make sure these babies are doing well and you're feeling good about feeding. Thank you.